3 days a week we would meet, and not knowing what we were doing or what to expect, and trying to figure out the distancing, the temperature taking.
We were constantly doing research from the CDC and what's effective and what we can do and what we can't do. It is our job to ensure that the staff are healthy, protected, and that's what we did. It was a tough time.
We slowly brought people back, oriented our staff, and had to do a lot of reassurance. We were able to give out the masks to the families, and we had sanitizer everywhere. And it was very difficult because for parents with babies, they had to trust us to drop their babies off in the lobby because they couldn't come in the building, and they couldn't come in and meet the teachers. There was a lot of stuff done on Zoom, but you're entrusting your most precious children to us, and we would have to have people pick them up in the lobby, and then they would bring them down when they were going, at the end of the day. We always knew that there was an injustice in the health system, but it really came to fruition during the pandemic.
Knowing something and experiencing something is two different things, in my opinion, right? So we knew that there were so many people who didn't have access to technology, but we didn't know there were so many people who didn't have access to technology.
Even the equipment that the kids got when it was time to go on online learning was not the same as in other areas.
Even with many of the schools providing laptops to kids because that's the only way they could be a part of schooling, it was still a barrier. Parents who couldn't operate Zoom, but having the expectation that they need to, one, know how to operate it themselves, but two, help their child.
It brought out a lot of those inequities, whether it be in education, whether it be in resources. It just brought out a lot of those things that we knew, and those kinds of issues that just affected so many families. The community is way different after COVID, and the isolation of just even when you're starting to learn how to socialize, and that wasn't available.
We have a system that's the code purple, code blue, code, and each of the codes mean something. Code purple means we need help in the classroom. Now, picture this, a 3-year-old. You're calling the code purple because a 3-year-old aggression is so heightened that the teachers need assistance in the classroom. Since the pandemic, code purples are called on a regular basis.
Going forward, it's going to be interesting to see how this will impact, especially small children coming up.
Being mission aligned is critically important in Marillac, and our mission is to eradicate poverty. Our work stays the same. Nothing else changes internally. Externally will always change, which means that there will probably be more need for what we do. But the mission stays the same.